Welcome to Healing Horizons. I'm Chris Daniels, your host, and today we're exploring a tender, vital topic: how Ibogaine therapy, delivered safely in Mexico, may help veterans process grief and loss. If you've carried the weight of fallen friends, difficult choices, or the abrupt shift from service to civilian life, this conversation is for you, and for families hoping to understand and support the journey. We'll cover what Ibogaine is, why it can open a meaningful window for healing, how to approach it safely, and what robust integration looks like afterward. My goal is clarity, compassion, and realistic guidance, grounded in science, clinical experience, and respect for tradition. And we'll talk directly to the veteran heart. For many veterans, grief wears multiple faces. There's combat loss, names etched in memory. There's survivor's guilt, the looping question of why I made it home. There's moral injury when actions or orders violated core values, leaving shame or despair. And there's identity loss after service, the sudden silence when mission, unit, and rank fall away. These experiences can feed depression, anxiety, hypervigilance, insomnia, irritability, and substance use as a coping strategy. Alcohol, opioids, or stimulants can blunt pain short-term while worsening sleep, mood, and relationships over time. Grief is not a pathology, it's human. But when it freezes into numbness or chaos, specialized care, sometimes including Ibogaine, may help thaw and reorganize what feels unmanageable. Inside, Ibogaine is a naturally occurring alkaloid from the West Central African shrub, Tabernanthe iboga, used within Bwiti spiritual healing lineages. In clinics today, you'll encounter three main forms: ground iboga root bark, total alkaloid extract containing multiple iboga constituents, and ibogaine hydrochloride, a purified salt with predictable dosing. Unlike classic psychedelics such as psilocybin or LSD, Ibogaine is often described as onirogenic. It evokes a vivid, dreamlike inner narrative with eyes closed, less about colorful visuals and more about memories, insights, and symbolic guidance. Sessions can involve extended wakefulness and deep introspection, making setting, and continuous medical oversight crucial to both safety and therapeutic value throughout the entire process. In the United States, Ibogaine is a Schedule I substance and not legally available for medical treatment. As a result, many people seek care in countries where regulated clinical practice is possible. Mexico hosts several medically supervised clinics that operate under local standards, allowing physician oversight, hospital partnerships, and continuous cardiac monitoring. Access abroad raises practical considerations: comprehensive screening done before travel, transparent risk disclosures in plain language, and a clear plan for continuity of care once you return home. Ideally, the clinic coordinates with your home providers and offers structured integration support, so the breakthroughs you experience there translate into steady, grounded changes in daily life for veterans especially. How might Ibogaine help with grief? Several hypotheses guide current practice. First, many report a disruption of rigid rumination, as if the mind's default loops pause long enough to allow new perspectives. Neuroimaging suggests related compounds can modulate the default mode network. Ibogaine appears to shift network dynamics in ways consistent with cognitive flexibility. Second, Ibogaine and its metabolite noribogaine may increase neuroplasticity by upregulating GDNF and BDNF, supporting learning and emotional updating. Third, noribogaine occupies serotonin and other transporters, offering mood-elevating and anti-craving effects that persist for days to weeks. Together, these effects can create a window where meaning-making, reconnection, and grief processing become more accessible, provided skilled therapeutic support surrounds the experience. Preparation, screening, and integration make it durable. It's important to distinguish what we know from what we hope. The strongest clinical evidence for Ibogaine is in interrupting opioid withdrawal and reducing short-term cravings, especially when protocols are carefully designed and medically monitored. For trauma, moral injury, and complex grief, support is emerging from case series, observational studies, and many lived experiences, but randomized trials are limited. That means expectations should be realistic. Ibogaine can open doors, but it is not a silver bullet. Some people feel profound relief. Others gain clarity that powers ongoing therapy. A few feel little. Success depends on preparation, medical safety, and months of integration within a broader recovery plan with trusted supports. Inside the session, many veterans describe a life review. Pivotal memories replay with unusual clarity, including deployments, homecomings, and moments of loss. Some encounter symbolic teachings, a stern drill instructor, an elder, or a compassionate friend who offers perspective or forgiveness. Others experience somatic releases, tremors, tears, or deep breaths that seem to unfreeze old fear. The one-erogenic state can feel intense, so the presence of skilled, calm staff is essential. They help you trust the process, stay oriented, and return to anchors like breath or a simple mantra. The goal is not to relive trauma for its own sake, but to metabolize meaning and reconnect with values that still guide your life during the days after. Safety is non-negotiable. A respectable clinic will complete comprehensive screening, detailed medical and psychiatric history, physical exam, baseline labs including electrolytes, liver and kidney panels, and a 12-lead EKG to evaluate QTc interval and rhythm. During dosing, continuous cardiac and pulse ox monitoring is standard, with frequent vital checks and an IV line available. Staff should be ACLS trained, with defibrillator, medications, airway equipment, and clear protocols. There must be a contingency plan, collaboration with a nearby hospital, and rapid transport if needed. Environment matters too. A quiet, low-stimulation room with a trained sitter helps reduce falls and confusion. Clear, informed consent ensures you understand benefits, risks, alternatives, and post-care responsibilities. Ask to see emergency drills and documentation. Contraindications are real and must be respected. Ibogaine is not suitable for people with known cardiac disease, a prolonged baseline QTc, uncontrolled hypertension, active liver disease, seizure disorders, pregnancy, or a history of psychosis or bipolar I. Side effects can include nausea, vomiting, ataxia, dizziness, sweating, bradycardia, and insomnia. Rare but serious arrhythmias have occurred, usually when screening or monitoring was inadequate, or when interacting medications were present. The solution is not bravado. It's careful medicine. If you're told Ibogaine isn't safe for you, honor that guidance and explore other paths. Your life matters infinitely more than any single modality. There are always additional healing options. Medication review is critical. Some drugs increase cardiac risk by prolonging QT. Methadone, many antipsychotics, some SSRIs and SNRIs, certain antibiotics, and others. Tramadol raises seizure risk. MAOIs and stimulants can be unsafe. Benzodiazepines require careful planning to avoid withdrawal and oversedation. Work with physicians to map a safe taper or transition plan. For opioid use disorder, many clinics transition methadone patients to a short-acting opioid for a period before Ibogaine. Buprenorphine strategies differ and require expertise. No plan should be improvised on arrival. Laboratories, EKGs, med changes, and stabilization of sleep and nutrition should be completed in advance, with clear documentation shared among all providers, including your VA team. Preparation sets the tone. Clarify intentions around grief, identity, relationships, and purpose. Practice simple grounding skills, breath work, body scans, or prayer. Stabilize sleep, hydration, and nutrition. Confirm travel logistics and a trusted support person. In Mexico, protocols vary. Some clinics use a single flood dose. Others use stepwise dosing to approach a therapeutic total more gradually. You'll be monitored closely for 12-24 hours in a quiet, darkened room with minimal stimulation. The experience can be long, with waves of insight followed by fatigue and reflection. Skilled staff will help you pause the narrative when emotions run hot, then return to it safely, harvesting meaning without re-traumatizing the nervous system. Plan extra rest days before traveling home. Integration is the engine of change. Expect 4 to 12 weeks of structured aftercare, weekly therapy with a trauma-informed clinician, gentle somatic practices, mindfulness, journaling, and gradual behavioral goals. EMDR or other trauma processing may be powerful, but many benefit from waiting a couple of weeks until sleep normalizes and emotions settle. Veteran peer support groups provide accountability and shared language. Include family sessions to repair communication and set boundaries. Build relapse prevention plans that cover triggers, sleep, nutrition, movement, and meaning-making. Ask your clinic to coordinate a warm handoff to your home providers and recommend integration directories such as psychedelic.support or local trauma therapy networks familiar with psychedelic-informed care, including VA community resources. When choosing a clinic, ask, who is the medical director and on-site physician? What's your screening protocol and QTC cutoff? Do you provide 24/7 monitoring, defibrillator, crash cart, and a named hospital partner? How do you manage med tapers and what aftercare do you arrange for veterans? Do you ethically source Iboga and support reciprocity with Bwiti communities? Compare modalities. Ketamine can rapidly reduce depressive symptoms and is legally available. MDMA-assisted therapy for PTSD remains under FDA review. Conventional therapies and medications still help many. Ibogaine may catalyze meaning and reduce cravings, but it's not magic. Budget for labs, travel, lodging, and months of therapy. Coordinate with your VA or community providers early. If you're in crisis, call 988 and press 1 for the Veterans Crisis Line or local emergency services. I'm Chris Daniels. Thank you for joining Healing Horizons. May this conversation support courage, safety, and compassionate, sustainable recovery today.